All right, so let's go ahead and finish our final kinesiology lecture on the leg and foot here. So first thing we're going to be taking a look at is the bones, which is going to include our femur here, our tibia and fibula of the lower leg, as well as the bones of the foot. We'll notice that there's a lot of similarities to this and the forearm and hand lecture. So let's go ahead and just take a quick look at a easy drawing that you could be able to replicate on yourself and be able to label and identify the landmarks of these bones. So right here, we've drawn a right leg, and we're looking at an anterior view in this particular case. So right here, we have the femur, then we have the bones of the lower leg, the tibia and the fibula, and then over here, we have the foot bones. So now we did look at the femoral landmarks of the upper half of the femur in a previous lecture. So we're just going to look at the few lower landmarks here. Namely, it's the two condyles. It's very similar to our humerus, where we had the medial and lateral condyles on each side. Same thing with the with the femur here. We have the medial condyle on the medial side, the lateral condyle on the lateral side. Now we do have a little bit of a depression here called the patellar fossa because of this bone, aka the kneecap, which is the patella. Then we look at the tibial bones and tibial landmarks here of the tibia. So of course here we can see that lines up with the respective landmarks of the femur. We have the medial and lateral condyles of the tibia. Of course, each condyle being on their respective side. Then we have the tibial tuberosity, which is the little bump here on the very front of the tibia of itself. So if you actually, felt below your knee, you'd feel a little bump right there below your kneecap, and that's just your tibial tuberosity. Then looking all the way down to the distal end of the tibia, we have what's called the medial malleolus. So together we have two, malleoli. We have one on the medial side, one on the lateral side, and they belong to the respective bones. So it's very important in this lecture to remember which bone is the medial bone versus the lateral bone, just like in the forearm and hand lecture, that the radius is the lateral bone while the ulna is the more medial bone. So the tibia in this case is our medial bone, and so has the medial malleolus. And then when we look at our fibula here, we have the head of the fibula being at the proximal landmark, and then we have the lateral malleolus, since it is the lateral bone. Now, very simple, right? Very easy bones, only a few landmarks there. Then of our foot, just very similar to the hand again, however, just fewer bones to actually remember. So first, we can actually break the foot down into different regions. So like we have our hind foot, midfoot, and then forefoot. But just to keep it simple, we'll just label out our bones. So from the furthest back, which would be the more posterior side of the foot here, we have the heel bone, and we'll look at a picture of a lateral view of the foot so you can see a nice example of this. But we have the calcaneus. The calcaneus is your heel. And then we have the talus, which is the more superior bone, which actually articulates in between the two malleoli to form a joint, as we'll see in a second. And then in the front, we have the navicular, which is a more cuboidal shaped bone, more cube shaped bone that we're going to see all articulate together to make a very interesting joint. Looking at what bones would be similar to the carpal bones of our wrist, we have the tarsal bones. That includes the cuboid, which is the more lateral of the tarsal bones. And then we have three bones on the inner side of that called cuneiforms. And well, seeing as we have three and they're all in a row, we have a medial, an intermediate, and then a lateral. So as I like to think, the big cuboid and its three cuneiforms, right, daughters, he's on the outside holding and blocking off any threats, right? So he's just the big daddy who is protecting his younger daughters, and his little daughters being on the inside of the foot here. We have the lateral one, the intermediate, and then the medial one. Moving into the webbing of the foot, we have the metatarsals, very similar to the hand. In the palm of the hand, we have the metacarpals. In the webbing of the foot, we have the metatarsals, which stem off of the tarsal bones, the cuneiforms and cuboid. So these are on the, essential plantar side of the foot, the bulk of the foot there, and they're long. And then we have the bones of the toes, which include the phalangeal bones, and very similar to the hand where we numbered our digits, starting with the big thumb from 1, 2, 3, 4, 5. Same thing with our foot, except our big toe is 1, 2, 3, 4, and 5 being our pinky toe, our small toe. Now, exactly the same as our hands, our thumb only had 2 phalangeal bones, while the rest of the other digits had 3 phalangeal bones. So that means that our big toe has 2 phalangeal bones, a proximal and a distal, and then all of the other digits have 3, which include a proximal, a middle, and a distal phalangeal bone. And then of the metacarpals and the phalangeal bones, we have 2 landmarks to pay attention to. The more proximal landmark is always the head, while the more distal landmark is, the more proximal landmark is the base, while the more distal landmark is the head. So that means that here's, we have base, we have the head. So that means that the head articulates with the base of the next bone in front of it to make a joint. And depending on which joint we're looking at or set of bones we're looking at, depends on the joint. So let's go ahead and take a look at just a different, more in-depth picture view of these bones. So here is the lower half of the femur, and as we see, we have the lateral and medial condyles. I mean, you don't need to worry necessarily about the epicondyles and stuff like that, like we paid attention to in the forearm and hand. And then we had the little patellar fossa, patella surface here, or the patella itself. Moving into the bones of the shin, right? Here we have the medial and lateral condyles of the tibia, the tibial tuberosity. Yes, there's the crest there as well, along the shaft of the tibia, but I don't think it's that big of a deal. And then the medial malleolus here at the bottom. And then for our fibular landmarks, head, shaft, and the lateral malleolus. And then here's the superior view of our foot, where we can see that we have, our calcaneus, the big heel bone. We have the talus, the navicular, our cuboid, 3 cuneiforms, the metatarsals, and the phalangeal bones. So very simple, very easy. Let's crack into our joints now. So let's just run through the joints and then we can do a brief physical demonstration, but I assure you they're not going to be too complicated or complex. Our first joint exists between the femur and the tibia, and we call this the tibiofemoral joint, which happens to be your knee. So we have the condyles of the femur and the condyles of the tibia that articulate to each other. And in a previous lecture where we talked about joints in depth, we said that this is a hinge joint, but it's a special type of hinge joint because of the rotational movements that it can produce as it moves into and out of flexion and extension. Because, well, as we know, hinge joints can only perform flexion and extension. However, there are minor degrees of lateral and medial rotation at this joint as we have the joint moving into and out of flexion and extension. And so this little caricature shows that, as you can see, it pivots and rotates into and out of its position during those movements. And I'll demonstrate that on myself here in a moment. Now, I know we typically don't pay too much attention to ligaments and stuff, but of the knee, I think it's important to label a few. So we have, because they're very long names, we have the MCL, LCL, ACL, PCL, and the menisci. So if I actually zoom in here, I'll just go ahead and draw a little bit first. So one, MCL stands for medial collateral ligament. And then LCL stands for lateral collateral ligament. And it's very similar to the forearm and hand. Collateral ligaments run vertically between two bones. So in this particular case, this is the lateral side of the knee. This happens to be the lateral collateral ligament, which more technically is called the fibular collateral ligament versus the tibial collateral ligament, which would be on the other side that we can't necessarily see right now in this picture. But the two collateral ligaments would run between essentially the bones on the medial and lateral side between the femur and then the tibia and fibula. So then we look at the ACL and the PCL. Now, I'm pretty sure most of the humans in this world have heard of the ACL. You've probably heard of it in regards to sports medicine, sports injuries, right? You probably heard about one of your favorite sports players maybe injuring this or so on and so forth. Well, ACL in this case, not collateral ligament, but stands for anterior cruciate ligament. And then PCL stands for posterior cruciate ligament. So anterior, obviously it's more in front than the other. Cruciate ligaments, cruciate, think like a cross, right? If you form a cross, it's an X, right? So if we actually, so these ligaments are actually inside of the knee. And so they help to prevent the forward shifting and backward shifting of the knee itself, so that it doesn't like rock back and forth in and out of position. So you can see that they're deep inside the knee and then they cross each other. So, you know, obviously the one in front is the anterior cruciate ligament, and then we have the posterior cruciate ligament in here. And then our last structure were the menisci. We do have a medial and a lateral menisci on, you know, pretty much on their respective condyles. And they almost form like gaskets and cushions for the knee. And they help the, you know, they help the bones to not wear and tear as they, you know, track through their movements. Moving into the proximal and distal tibiofibular joint, very similar to our, forearm and hand, in the sense that, well, it's just the joint between the two bones here. Then, you know, it's exactly the same, except for our, you know, radial ulnar joints allowed for that pivoting movement that created supination and pronation. Our lower leg does not do that. It would be kind of freakish if we did. So they are pivot joints, and they do allow for slight bits of movement, but not a whole lot. Then we look at the talocrural joint, which is the technical name for the ankle. So this happens, you know, it's kind of, you know, maybe more of an anterior view instead of a lateral medial view, would show you that the talus, the more superior bone of the, you know, foot, is nestled in between those two malleoli. So the tibia and the fibula articulate with, well, the talus that needed to be split, more specifically the malleoli of those, and it forms a hinge joint in this particular case. So if we actually, you know, and I got some bones here I can show and demonstrate here. Actually, yeah, it'll be a nice little demonstration on that. You can see that this particular movement only really can allow based off of the, you know, space available, flexion and extension. Now, when it comes to the foot and ankle, we have some different definitions of flexion and extension. So flexion in this case is when the foot would point downwards. So my toes would point towards the ground, but we call that plantar flexion. Because you would imagine, well, this is the plantar surface of the foot, and it's moving downward, right? So we're almost like planting our foot into the ground. And then we have extension, which is to point my toes upward, or to essentially bring the top of my foot towards my shin bones, aka my tibia and the fibula. We actually call this dorsiflexion. Now I know that both of these words, plantar flexion and dorsiflexion, have flexion in the name, but one is true flexion while the other is true extension. And how I like to imagine it too, so dorsiflexion, right? I like to think like this foot looks like a little dolphin, or maybe even a shark, right? And we have the, maybe we'll draw a little friendly dolphin. Look at that. And so the dorsal fin is on the top of the foot in this particular case. And so when we move the foot upward towards the shin, we have dorsiflexion, which is true extension. Some notable structures, we have the deltoid ligaments. I like to point these out simply because if you happen to see these in your life or on a test, well, you would see deltoid ligaments and you would think that they're in the shoulder because we know that the deltoids are there in the shoulder. But however, in this case, the deltoid ligaments exist on the medial side right here of our ankle. Thank you, sir. So that is our talocrural joint, which performs flexion and extension, so it's a hinge joint. Now you wonder, well, how do we do the other articulate and intricate movements of the foot? Well, that happens here in the talocalcaneonavicular joint. I know that's a mouthful of a word, but we can actually break that down. Talocalcaneonavicular. It happens to be the three individual bones that we saw essentially on the back of the foot. So the talus, the calcaneus, and the navicular bone all come together to form what we call a pseudo ball and socket type joint, which allows for just this amalgamation of different movements to be able to perform the inversion and eversion of the foot, which we also call supination and pronation. So inversion is supination, which is to point the foot inward or towards the center, and then eversion is pronation, to point the foot outwards, or vice versa. So then we look at the bones of the joints of the foot. We have the tarsometatarsal joint, which is the joint between the tarsal bones and the metatarsals. And of course, they don't move a lot. So as we know that we can't technically like bend or move this part of our foot and make like a claw hand like an ape would. But we do see we have the metatarsophalangeal joints, which are the equivalent of the big knuckles of our hand. And so those can perform lots of movement. Granted, we might not articulate those joints as in depth as we do with our hands, but they can still perform the same movements, which includes flexion, extension, adduction, abduction, and even circumduction. Yes, if you concentrate well enough and coordinate your muscular effort, you can move your big toe in a circular fashion. So these are condylar type joints, as we find to be between, very rounded condyle-like structures and shapes. And so, and then of course the interphalangeal joints, exactly the same as our hand, right in between the two phalangeal bones. So in the big toe, right, we just have the interphalangeal joint. In all the other toes, we have the proximal and distal interphalangeal joint, but they're all the same in a sense, where they're hinge joints only performing flexion and extension. So let's go ahead and take a look at me performing those movements real time. Now, so of our knee, and then I have a little skeleton I can show and demonstrate, we have flexion and extension. But if we actually pay attention, watch the tracking of my knee. So as I flex, you can see that my leg starts to come out this way. So we have this medial rotation and then lateral rotation as we move in and out of that. And we call that the screw home mechanism. And then my ankle, my talocrural joint, can do flexion, plantar flexion, extension, dorsiflexion. And then I can do inversion, eversion, supination, pronation. So let me show you, just a bit of a 3D model. I know it's kind of hard to demonstrate those particular movements just on myself, but here we have a leg, right? So we have our tibiofemoral joint. Now, of course, because of the way that this is melded together, I can't really do the rotation movements, but we have flexion and extension And in this particular case, just to show you where our menisci would be, the menisci sit right here in this femoral like fosses here. And they just, again, serve as like a little gasket as the condyles of the femur articulate there. Here is our talocrural joint. As you can see, the talus sits in between the two malleoli for dorsiflexion and plantar flexion, flexion and extension, right? So plantar flexion, flexion, dorsiflexion, extension. Then we have the talococceinal and navicular joint, able to invert, evert, supinate, pronate. And then we have the metatarsophalangeal joint, able to do this whole springy movement. So we have flexion, extension, flexion, abduction, adduction, and then, you know, the circumduction, which is the circular movement. And then just flexion and extension at all the interphalangeal joints. So hopefully that kind of can come across. I know it's a little difficult, but you know, I mean, it's almost the exact same if you watch the video on the forum and ham. Our wrist and ankle is almost identical. Hand and foot almost identical. So let's crack back into some of these muscles, right? The bulk of the lecture here, and just a brief demonstration of those movements there. Our first muscles up are the muscles of the calf or posterior side of the leg. We have three muscles in our calf group, which includes the gastrocnemius, the soleus, and the plantaris. So now, two of the main muscles we all should recognize and remember is gastrocnemius and soleus. Plantaris almost often gets kind of left out of this group, but shouldn't be forgotten per se. So let's take a look at some of these landmarks. Again, when I talk about learning the landmark or to talk about learning muscles in general, you should just be able to look at a picture of a muscle, and based off of just that picture, try to identify what it's going to do. So as we can see, we're attaching here to the calcaneus, and then we're actually attaching to the posterior side of the femur to the medial and lateral condyles. So what's going to happen? Well, one, I'm passing the knee joint, so that's going to produce something. And then I'm passing the ankle joint, so that's going to produce something. But what? Well, in this particular case, now we just need to follow the direction of the pull of the muscle. And we'll see that, well, if I pull here to here, well, I'm going to produce flexion of my knee. And then here, I'm going to produce flexion of my ankle, aka plantar flexion. So as we can see here, as labeled out, so the origins are the condyles of the femur on the posterior side, that is. And then we're inserting, and then all of these muscles insert onto the same landmark. They all insert onto the calcaneal bone via this calcaneal tendon, or as we would commonly call it, the Achilles tendon. So in this case, as we saw, right, flex the knee, plantar flex the ankle. Now, looking at the soleus here is very interesting. It's actually on the back of the leg. If we zoom in, it's on just the lower part of the leg. It actually doesn't cross the knee. So that's an important detail to notice, that unlike the gastrocnemius, the soleus does not affect the knee. It solely affects soleus affects only the ankle, and in this case, it's just plantar flexion of the ankle. Now, plantaris attaches past the knee, so actually can affect the knee as well. In this case, you know, performing flexion of the knee and plantar flexion of the ankle as well. So those are our calf muscles on specifically, and we'll see this later in the lecture. These are on the posterior surface of the lower leg, which we call the sural region. I think there's an E in there. I have the spelling later on. So the back of the leg is called the sural region. Looking at our next muscle, we have Popliteus. Popliteus, well, popliteal happens to be the region known as the back of the knee. So Popliteus is in the popliteal region. So it's often known as the key to the back of the knee, as this muscle originates here, as we can see on the tibia, and then it reaches across to the lateral condyle of the femur, and it just produces flexion of the knee, as well as a bit of rotation based off of its pull. So very simple muscle, but Popliteus, main thing to know is, well, it's in the back of the knee. It's in the popliteal region. Then we have the peroneal muscles, also known as the fibularis muscles. So in some texts, they don't use this word anymore, the peroneal word. Peroneal. But peroneal is just an older anatomical word that refers to this same area, which is the fibular region of the lower leg, or in this case, the lateral side of the lower leg. So the peroneal muscles, also known as the fibularis muscles, are right here on the lateral side of the leg, and they attach to the fibula. And in this particular case, I mean, kind of hard to see. They wrap underneath that lateral malleolus and attach to the bottom of the foot. So in this particular case, let me draw this. We're actually going to have this bit of movement as well as, so like, this is the direction of our pull from that muscle. So we're actually going to cause eversion of the foot. So we're actually going to cause that pronation of the foot. The foot's going to turn out, and plus, with the angle we have, we're actually going to perform a slight bit of plantar flexion with these muscles. So now in this group where we have peroneus longus brevis, there's an even shorter, smaller muscle called peroneus tertius, but essentially they're all doing the same thing, right? They're all coming from, and we can just kind of X-nay all of that out, right? If we can just visualize where these muscles are and what they're doing, we'll be okay, right? They are coming from the lateral side of the leg, the fibula, and they're wrapping up underneath the foot, and so they're performing eversion because of that pull and plantar flexion, in a small degree. And like we said, right, fibular, also known as peroneal region. Then we're into the plantar flexors and dorsiflexors of the ankle, which, very similar to our flexors and extensors of the forearm and hand, there's a few golden rules we can use to remember them. So if we can remember these few easy rules, we can summarize and simplify these few muscles that we need to know. So first and foremost, it's a lot easier, in my opinion, than it is with the forearm and hand, because there's only 6 muscles in total. We have 3 muscles on each side, the anterior side and the posterior side. So we have 3 muscles in the flexor group and 3 muscles in the extensor group. So the dorsiflexors are all involved with extension, right? Because dorsiflexion is extension, and plantar flexion is true flexion. So if a muscle is going to dorsiflex or extend my ankle and toes, then it has to be on the front of the leg. We call that the crural region, which is the front of the lower leg, the crural region. Then our plantar flexor muscles, or flexor muscle groups, are on the back of the leg, which again we call the sural, right? So pretty much all of these are involved with their respective actions. If they're extensors, then they're going to do extension, which is dorsiflexion. If they're flexors, then they're going to do plantar flexion. And so this is the one golden rule right here that is going to separate the main super niche thing, which is all of all of these 6 muscles, 5 of them are going to evert the foot. Only one out of these 6 muscles inverts the foot, which is extensor digitorum longus. And the reason is because this is extensor digitorum longus, you can just see by the pull, the direction of the pull, it's actually going to shift this foot to be into eversion. Then if we look at all the others, this happens to be extensor hallucis, right? This is onto the big toe, right? It's going to extend, the big toe. So you can see that pull is going to invert. This is, this is extensor hallucis. That was tibialis anterior. Again, it's still going to do the inversion of the foot and dorsiflexion of the ankle. This is tibialis, extensor hallucis, longus, and it's going to extend the big toe and extend the ankle. And then right here we have on the back of the leg, that's tibialis right here, posterior, flexor tibialis posterior. Then we have the flexor digitorum and flexor hallucis. So let's just go ahead and take a look at those muscles and all the names. And as we can see, so we have these muscles right here, the tibialis muscles. We have 2 tibialis muscles, and we have 2 digitorum muscles, and 2 hallucis muscles, as we can see. So we have 1 on each side. So that means tibialis posterior is on the posterior side, which means, well, it's part of the flexor group. Flexor digitorum, well, if it's flexing, it's going to do plantar flexion. It's on the back of the leg. And then flexor hallucis. So hallucis here will give us an indication of what we're talking about. Hallucis is the big toe, very similar to our thumb, which was pollicis, right? So these muscles act only on the big toe. And another similar rule to our forearm and hand lecture is that the big toe, as similar to the big thumb, has its own muscles to move them. So that means that our digits, the other toes, in this case, toes 2 through 5, have other muscles to move them. And as we can see here, if we look at the commonality, inversion of the foot, well, that's because this is extensor digitorum longus, does eversion of the foot, but inversion, 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 inversion. So all of these muscles, except for extensor digitorum longus, invert the foot. Tibialis is just involved with either flexion or extension of the ankle. So depending on its respective side, it's going to dorsiflex or plantar flex. So tibialis anterior is the dorsiflexor, tibialis posterior is the plantar flexor. And then the rest of the muscles do the exact same thing, right? They're either going to flex or extend the ankle, but then they act on the other things in their name. So if it's digitorum in the name, then it's going to act on the toes. So in this case, all of the toes except for hallucis. And then hallucis is going to act on exclusively just the big toe. And then same thing, if we, like I said, if we look between flexors versus extensors, it's the same makeup. So just by understanding the generic rules, we should be able to associate what's going on with these muscles. They're not too complicated. So we do have some small, shorter extensor and flexor muscles, extensor digitorum brevis and flexor digitorum brevis. Well, in this case, they're on the top of the foot or on the bottom of the foot to help to continue to flex and extend the toes. So looking at these few things, right, we already listed it, so I guess it didn't have the E there. The crural region, as we said, was the front of the leg, the front of the shin, and then on the back we had the sural region, which is the calf region. And fun fact, the calves are often referred to as the triceps surae. So just like our triceps and our upper arm, right, had 3 little muscle heads, well, the triceps surae is the calf muscles of the lower leg. We also have the interosseous membrane, very similar to the forearm and hand, where we had this matrix of connective tissue in between two bones, because if we break this down, inter means in between, os refers to bone, so osseous membrane is a membranous structure in between two bones, and in this case, well, the two bones being the tibia and the fibula. We also have, very similar to the forearm and hand, again, I mean, like I said, it's just, I keep saying that, right? It's just almost copy and paste. But we had the retinaculums in the forearm and hand. Well, we have a flexor and extensor. In this case, well, that says peroneal, but extensor and flexor, peroneal being on the lateral side, what holds down the flexor tendons itself. And well, they just do that. All they do is it's just like my wristwatch, right? If my wristwatch just wraps around my wrist and holds the tendons of these muscles down so that they, you know, don't like stick out like this, because it'd be very creepy if my foot just, or just my, yeah, like if the top of my foot just webbed out because the tendons were just twang, like stuck up and pulling the skin. So the retinacula will hold the tendons down. And then we get into the pathologies, which we already have in another video. So that is the bulk of the lecture. It's a very simple, very quick and easy lecture. You know, we obviously didn't go through all and every single muscle of the foot and everything, but I think that's the bulk of what you need. Again, very similar structures to the forearm and hands. You know, just remembering most of your bones, specifically your medial versus lateral bone, the tibia being the medial, fibula being the lateral. You know, loosely understanding what bones you have in your foot and the joints consisting within them. But otherwise, you know, just those few flexor and extensor muscles groups with those general rules will get you by. And I think that will be the end of our lecture.